And please stay on if you're interested in learning more about the EYT accredited yoga therapy training, and welcome those of you who have just joined us. Felicia, nice to see you, and I see you have a little cutie pie with you.
Yes, he will be popping his head up a lot, I'm sure.
It's okay. Let him pop away. Looks adorable. And then Maureen, hi, welcome. Maureen is a student in the current yoga therapy training, and she was kind enough to agree to come today so that you could also hear from her and her perspective of the program. Let's see. Becoming a yoga therapist is serious business. And I think I wrote this to Donna in our communication this week that, not everybody is called to become a yoga therapist, and being a really highly qualified and knowledgeable yoga teacher is enough. It's good. Okay. So I don't hold that if you really want to teach yoga well, you have to become a yoga therapist. I do believe you have to pursue good, deep, thorough education to become a good yoga teacher. And I will say this, if you hang out with me, you'll find out I have strong opinions and I don't hold back on them. 200 hours is not enough to be a highly educated, informed, and competent yoga teacher. You can be a really good person, right? It's not personal. It's just not enough time. I used to do that. I used to teach 200-hour trainings, and after I would finish each session, I would come in and cry, literally, because it's like, I don't have the time to teach them what they need to know to really come out the other end and have what I feel like they need to do this work well. I always felt like I was compressing and pushing and not enough time. So then I gave up on 300 hours. I already knew that was not going to be enough. So I just went straight to 500 hours. And then I went to yoga therapy and did the 800 hours. And then I decided that wasn't enough. So anyway, Melissa and I just went through the process. Melissa Campagnolo, who's one of my dearest assistants. I don't know how I lived prior to her support in my life. She and I just went through the IAYT reaccreditation process, and I think came up with a total number of hours of our accredited program. It's over 1,300 hours. And I'm not willing to take anything out, just how it is. What I've added is, in the last couple of years, is a lot more Ayurveda. I have an amazing Ayurvedic team, DEIA team that is phenomenal, that is bringing so much richness and depth to our program. And I feel at a very deep heart and soul level that's in integrity with my own beliefs. And it takes more time. So that's how it is. Our faculty is stellar. Our mentors are fantastic. The depth of knowledge that you'll receive, whether you do the full 1,300 hours or just do the foundations of yoga therapy, which is 300 hours on top of your 200 hours, will give you so much more than what you have right now. I promise you that. For yourself, for your own understanding of how, like, what yoga is all about, first of all, which in a 200 hours, I mean, there are some excellent trainings out there that actually communicate and convey some aspect of depth and breadth with the teachings. They're few and far between because it's just hard to do in that time frame. But the depth and the breadth of the teachings of the Yoga Sutras, and then understanding how to teach the basics of really good adaptive asana, to be able to understand how to look at somebody's body and assess how they need to adapt a particular asana practice to be supportive and healthy for them. It takes time. And there is anatomy that needs to be layered in. And we just spent the last, 45 minutes talking about the breath and how important and essential the breath is to understanding functional breathing, which is, all of my programs start with functional breathing. The RYP, Restoring Prana program, obviously goes much more in depth just on that, but all of my programs incorporate that. So you've got philosophy, you've got breath, you've got mind with the Yoga Sutras. So how does the mind function? Eastern psychology, essentially. And then practices like mantra and mudra and all the various meditative practices, like how to utilize those in a way to actually customize it for this group of students or this individual to be a really good yoga teacher. That's foundations of yoga therapy. And how to use those tools to transform your own practice so you are growing and developing yourself through these tools as a human being. Then in applications of yoga therapy, we go deep into the Ayurvedic physiology and how to use Ayurvedic cooking towards healing and balance. We go through each of the systems of the body, and I have doctors and nurses and Ayurvedic physicians who are on my staff, part of my faculty, who come in and teach those. And then I teach the yoga therapy strategies around it. I stay in my lane. I know what I know. I know what I don't know, but fortunately I know the people who know what I don't know and are really good at teaching that. So they bring that forward. And so through the applications portion, which is when you'll be doing your practicum, you're learning simultaneously about the mind, the body, the physiology, and how to customize like common pathologies, the Western terminology for that, the way the Eastern view looks at those health imbalances, and then how to mix and match the tools of yoga to customize practice in a therapeutic way for this particular person or this small group of individuals with this particular common ailment. It's a lot to learn. It's not, it's a graduate level program, and it needs time and it needs energy. You can't do it as sort of like a sidebar thing in your life. I would say when students are in this program, this is a center point of their lives. And they still have families. I have several students with young children, and there's juggling, but they manage. Not so much the ones with babies. That's a little more challenging. And they are teaching and or working part-time, but it's a lot. And so it needs time and to respect yourself, to understand that if you dive into this, there is a lot of work. It's a big commitment. I personally, what I hear on the backside as people have come through it is that they feel like forever themselves have been changed with foundations, and their teaching has been transformed. And then the people who really want to become yoga therapists and want to work in that healing, at that healing level, find that they are thrilled. It's so rewarding to be able to go out there and have something to offer the people. The people that we see are not the simple folks, right? They're the people who have chronic, complex psychophysical, physiologic issues that have been there for a long time that nothing else has actually addressed. And because yoga has this fabulous way of weaving and intersecting all the different aspects, instead of like you're depressed, go over here. Oh, you have back pain, go over there. It's like, let's look at what's going on in your life that's producing both depression and back pain. Let's address them simultaneously because they're feeding each other, right? The less you can do the things you love, the more depressed you get. The more depressed you get, the less you want to go out and feel the impetus to go out and do the things that would actually move your body and maybe get you feeling better, anyway. So like that. So it's a wonderful, I mean, I love being a yoga therapist. I love training yoga therapists. And I feel like our program, because we take the time to go deep and not rush through it, that students come out really feeling like they have the tools, even if they've never heard of this particular syndrome before. And there's like every day there's a new one being named or whatever, like that they can go and do some research, and then because of the foundation of our program, be able to at least have an understanding of a start point from the yoga perspective. You know, it's like Diana Perez, who is with us for the last 2 sessions, was talking about she's a physiotherapist, right? And she's just done the Restore Your Prana training. And she was saying to somebody who was concerned with the low back training that she doesn't know enough anatomy. And here's Diana as a physiotherapist saying the anatomy is the least part of it, right? Like that's knowing every single bone and muscle and ligament. That's not really what heals people, right? So in the same way, like we don't have to be doctors. We don't have to know what doctors know. But as yoga therapists, we know a whole lot that doctors don't know that people need. And it's really a necessary piece of the healing process. And we can work in teams with occupational therapists and speech therapists and chiropractors and massage therapists and orthopedic docs. Like I have all of those people in my network of referrals, right? But what I offer is something that they don't, and that can really support what I hear in feedback from them and what I've received in feedback from the students, the grads from my training program, that they hear is that the yoga therapy offers something that helps promote the healing process and also empowers the individual to feel like there's something that they can resource inside themselves, do for themselves, that they're not constantly having to go to this one and that one, and their life is already full of one appointment after another looking for answers, and that yoga offers them something they can sit themselves down or lie themselves down and take themselves through a very simple therapeutic practice and feel a sense of healing, a sense of regrounding, regrouping, centering, and more at peace within whatever condition they're contending with and whatever treatment protocol they're contending with in their lives. So I'll start with that. I'm going to actually invite Maureen first to share as a current student in the program about her experience. And then Melissa and Llewellyn are here, and they can share from their experience, both as graduates from the program and now mentors within the program. So, and Llewellyn is a mentor for both foundations and applications, and Melissa's a mentor in applications. So we can also look at the 2 different parts of the program if you want to break that down and get a little bit more granular about each one. Maureen. And again, thank you so much for taking the time today to do this. It really means a lot.
Oh, yeah. Well, hi, everyone. I have really enjoyed this program so far. I was on a walk with my husband earlier, and I mentioned that I was coming on this call, and I was talking about the program, and I had taken my 200-hour training over 10 years ago, and I was talking about how much I've learned, and I said, I think my yoga knowledge from the 200-hour training is 5% of what my yoga knowledge is now. And we still have, what,
a year.
8 more months to go.
A year, pretty much a year.
Yeah. So the amount of information is plentiful. The level of training is deep. There's definitely no phoning it in. You know, it's in all of the sessions, people are alert, engaged, and sharing, participating in the conversations. The homework is real, and takes some time and thought. But along with that, especially in the foundations, there's a lot of reflective practices that I feel like that foundations program is just beneficial for any human to understand themselves better. And also I found that I improved the relationships with the people in my life greatly from taking that program, having a better understanding of myself, how I interact with people. And that was really useful in itself. I had been working with private students for a while and was wanting to bring more knowledge to those students. And I've been able to do that and then some. So like beyond my expectation of what I thought I could bring. And then I guess the other part of it was the thing that I didn't know I was missing in my life is the Sangha, is the community of the group. Especially, we were sort of coming out of and we're really still in COVID times. I don't know if we're ever really out of it, but deeper in it. And having the connections with people over Zoom to start, really getting to know everyone. And then the times that we meet in person was so enriching. So that part really fueled my life and also brought joy in my life that I didn't realize I was missing, the joy of that community feeling. So yeah, I would say I agree with what Robin was saying, where, it does need to be the priority in your life. It takes
Technology. All right, Maureen, I'm going to assume at some point you're going to be unfrozen and we'll hear back. Oh, there we go. Maureen, hang on a second. You were frozen there for about a minute and a half. So after you said priority in life, we lost you.
Okay.
You could pick up that thread.
Yeah. I guess, that it takes, and not only does it take the time where you're on the calls and the weekends and working on the homework, but at least for me, I needed a lot of time for reflection because there's big questions in the homework and we're discussing big things. And I also am someone that needed to learn how to kind of rest and digest and assimilate things, and learn how to embody the teachings and let them sink in. And so when I was able to step back and give everything a little more time and space and start doing that more, I was understanding things on a deeper level. So if you can have the luxury of spaciousness in your life, there are people in the program who have kids and are making it work, and I bow to them. But it's definitely not like, I've got a lot of different things going on and this is my side thing. I think you want to give it some space and some priority in your life because it's, it's deep work and you want to be thoughtful and you don't want to phone it in. You really want to bring everything you can to it and get the most out of it because there's no lack of content or information or challenge. So if you're afraid of that, don't be afraid of that.
I just want to say there's also lots of loving support. The mentors are so willing and able to jump right in and offer a little bit of a, a sounding board if you just need to cry and vent, a little bit of, like let's step back from it, take a look at how we can use the tools of yoga right here and now to help you to regulate your nervous system, right? And then let's help with some time management. Let's figure out a timeline for you getting your homework in and shifting this pattern, right? Like they're right there and holding your hand the whole way. And then everybody has access to me. So it's, you know, like you have your mentor and the relationship with them, and they're also keeping me informed and going, by the way, so-and-so is really struggling, just have this job change or whatever, just want to put you on alert. They seem to be doing okay, but I just want you to know. So I'm always like staying in touch with what's happening with the student body. And then you don't have to go through any intermediary. If you want to contact me, if you have something that comes up in your personal life and you want to address it directly with me, or later on in practicum, you have something that comes up with a client that you want to have my opinion, you know, weigh in on, I'm right there. So we're really a tight family. And then what I see amongst the students that's really beautiful is this lovely support system that you guys make with each other, that like I'm not orchestrating, it's just coming through by the deep sharing and the willingness to open and say, this is who I am and this is what I'm struggling with, and then hear somebody else say, oh my God, I feel that way too. And then there's such love. Oh my God. I mean, you guys, you know, you make me cry every time we come together because it happens with every group to a greater or lesser extent. This particular group has really bonded in such a sweet way. And anyway, it's quite moving. And then they turn to each other for support. They make little study pods with each other, or little, you know, accountability buddies, so that they can help each other to move through the program and face the challenges. I mean, right? If it was easy, would it be worth it? I don't know. I mean, I'm not always that everything has to be hard. I'm a big believer in play too, believe me. I could do a whole info session just on how important play is. I'm super good at it now. It didn't used to be. But anyway, but for this, it does require work. It does require commitment and intentionality. So yeah. Let's hear from a little bit from Llewellyn and Melissa. Just want to give you each a little bit of maybe just sharing what it's like from your perspective as mentors.
Okay, I'll go first this time, Melissa.
Yeah. And also Llewellyn, talking about the difference maybe between mentoring and foundations and applications, because it's a slightly different role.
Yeah, for sure. So I've been a mentor for foundations for a couple rounds, at least, and went through, of course, myself. And there is a lot of emphasis on working with yourself in terms of identifying samskaras. There's a lot of work with the Patanjali Sutras to help create a container to work in. And then, of course, the asana, the body journals, and the breathing practices. And then, of course, there's all the structural things that we start to introduce as well. But I think the main thing about the Foundations program that is so wonderful, not only are you doing a more in-depth teacher training that takes you to 500 hours, you know, plus, is that it's kind of like not necessarily clearing, although there is that, your own personal stuff, but recognizing it. And like what Robin was just saying, and Maureen, about the support that's there around it. So as a mentor, I feel like that's a lot of my work, is having people or facilitating, guiding the students to understand that recognition through the lens of yoga, and not only through the sutras, but through the body stuff. You know, people come in with body stuff all the time, or breathing patterns. They may not know the type of breathing that Robin has as the main type of breathing practice. They come from other other ways. And so it's a switch of knowing, like a bigger knowing. And as a mentor, I feel like that's where my work is to help understanding, help guide, help to work through all that stuff. And then of course there's the practical things too as well around the anatomy trains and other types of ways to understand how to teach. So that I would say would be the main thing for foundations that sets up the stage. It's such a so beautifully structured to then when you start to work in the applications of yoga therapy, that that you know what you're bringing to the stage, you know, with your work. You know that more about where your blind spots are, where your triggers are, where your superpowers are, you know, all of that, so that when you start to take these literal applications of yoga therapy into practice, and there is a lot of support in that, in terms of when you start to work with clients as a therapist in training, that you know that you have more of an idea of where you're, where you can be most helpful, where you need to learn a little bit more. And again, as my role as a mentor, that's where I help to be a mirror, I hope, a reflection on that for the students, and also to help work it through wherever needs to be worked through. So, and setting, you know, a container, a structure when it's needed, and also to kind of calm down the sometimes over exuberance that can get in the way as well, coming from that side of things myself. So I would say that's kind of the, you know, if I were to put it in a nutshell, there's so much more than that, but that would be kind of the way that the two programs work together. And I see how the foundations program is also, it can be an independent way that type of learning can also be useful in the yoga studio for classes and that kind of thing. So anyway, I hope that was enough. Now I know we have time for everybody to say something too, but I love being a mentor in the program. It feels really or just like I feel kind of honored, you know, to be in that role. So
Thank you so much, Llewellyn. Melissa?
I feel like, having been here all afternoon, I feel like we keep seeing the same themes with Robin's teaching again and again, and it's that personal exploration. And I feel like foundations is such a big part of that. You explore these teachings yourself, right? And transform yourself through the practices. And then through the Sangha sharing, it's really fascinating because you get to see what other people have going on and what their experience is. And then when you get to applications and you start to see clients, you've got that experience behind you. You've got the didactic information that you're getting as we go through applications. And then you're seeing clients and it's helping you digest that information. And you're seeing clients within a structure. So you're meeting with your mentor, discussing your client work so that you don't feel like you're out there alone having no clue what to do. And we're trying to create that safe environment where you get to explore. And it's okay if you don't know, you can ask for help because we want you to learn. That's why we're here. We're all very passionate about that. So that's one of the things that I've been really enjoying. And just as you see things come up in foundations about yourself, that you learn about these samskaras that you didn't realize that you have, what I'm recognizing as a new mentor to this program is that we have some samskaras about how we learn and how we turn in homework. There's some emotional baggage that comes along with that. And the mentors are here for you for that too. And so I just wanted to plug that little piece in there.
Yeah, thank you.
I also love being a mentor, I'll just say.
I so appreciate you bringing that out, Melissa, because yeah, people have different learning styles, right? And so we really do our best to accommodate that, to recognize, to more like, oh, this is what's happening. So then let's just like back everything up. Let's just do some time management stuff, like get get that piece organized and support. Maybe this person needs a little weekly reminder, a little check-in bi-monthly, like it's not enough just once a month. So, and the mentors, like they're, yeah, like I just said, very generous with their care, with their time and their energy. They're devoted to doing as much as they can to support people through the program on every level. Yeah, yeah. Okay, so let's hear Felicia, Donna, Sangeeta. Where are you at? What's your interest in yoga therapy? What are your thoughts on becoming a yoga therapist? Your vision for that? Sangeeta, yeah, jump right in.
I'm interested in knowing when you say application of yoga therapy, can you clarify further what it entails?
Yeah, so there's two parts to the program. The whole program is 1,300 hours. The first, the foundations of yoga therapy, which is it's a 3.5-year program total. The first 18 months is foundations of yoga therapy. And that's the piece that Llewellyn was addressing with where we go into deep study of the Yoga Sutras, looking at asana, kind of breaking down asana, looking at it through the lens of common patterns, movement and postural patterns. Think of it like advanced teacher training on that level, looking at it through the fascia lines and breaking it down to look at how different asanas can be adapted, taking it out of these are the cues for Vera 1. We don't do that. Just know that will never happen. It's all about what's the intention with utilizing this pose or putting this pose in a sequence. What came before, what came after, what's the overall intention, how are you adapting it, and how are then for a group, and then how are you individually adapting it for this person with a shoulder problem, or this person, right, with who's healing from an Achilles heel tear or whatever, right? Like, so that on the asana level is what we cover. And then there's always the reflection on the mind and the work with the breath. And then learning to work with tools like mantra, using Vedic chanting, and mantra as a tool for transformation of the mind, using mudra for grounding and stabilizing the mind in other ways, and then meditative practices and being exposed to them. So the idea with foundations is you're exposed to the tools of yoga and sort of a general way of addressing what may come up in a generic group class that takes you more in a therapeutic orientation around mind, body, breath stuff. So you come out with a rich set of tools, and every tool is first passed through your own system. And there's, processes for experiencing that, and then lots of time given to discussion, because I have my experience, but Melissa did the same practice, but she's a very different person than me in so many ways, right? And her experience, she says, I had this experience, and I'm like, what? And then Maureen says, but I had this experience. And then you start to, this is important. It's important to understand. It's not like yoga RX. Do this practice for this, do this pose for this. I'm sorry, that's BS. There might be an idea, but how a person experiences any particular thing is unique to them. So the more we listen and hear from each other, the more that also sets the stage for when a client comes in and they have back pain or they're having insomnia or anxiety. You don't automatically assume it's the same as yours, because you heard Melissa has a different kind of anxiety. Llewellyn has, like her insomnia is very different than my insomnia. Like, right, there's already that understanding. And then how do we adapt for this person? And of course, we bring in the Ayurvedic doshas and a lot of the subtle body work and understanding in the psychology. We have a clinical psychologist who teaches a great portion of the first year of applications. So applications, when we get there, is really about, okay, you did all this personal stuff. Hopefully you have a better understanding of yourself and have cleaned up some of your baggage so that you're a clearer vessel for therapy, for offering therapy. Secondly, you have a much better, more sophisticated understanding of the tools of yoga and how the tools of yoga can be transformative. Now let's talk about pathology. Now let's talk about not just your normal kind of neurotic, stressed out self like we all can be, but like what happens when you have somebody with clinical depression, with generalized anxiety disorder, with OCD, with ADHD, right? Like, let's learn about those conditions from a Western perspective and then take the yoga teachings and the practices. How would you address that? How would you work with that? The Ayurvedic understanding of mind. How do you weave that together to work with somebody with psycho-emotional issues, other than just sort of, I'm just stressed because I have a lot on my plate, right? And then the same thing for the structural issues. It's one thing to just, I have a little tension in my lower back versus how do you work with somebody with a severe, who's had back surgery? How do you adapt for them? Or knee surgery, or is trying to avoid shoulder surgery, or has frozen shoulder. That's different than just I have tight shoulders, right? So you go from a sophisticated yoga teacher to actually understanding the anatomy, the physiology. We get into, like migraine headaches and IBS and Crohn's disease, and right. And, working with people with cancer. So all of the physiologic, all the structural, psycho-emotional, like the common ones that you'll encounter, and then how we utilize these tools of yoga for working with them, and you're learning all that simultaneously with actually seeing clients one-on-one. That's the applications portion. It's listen, I have one of my original developers of the program was a board certified psychiatrist. And when we were developing, we took a whole year. There were 4 of us, chiropractor, an Ayurvedic practitioner, and then this board certified psychiatrist and me, and we each took a portion of the program, like the Ayurvedic portion, the musculoskeletal portion, right? The psycho-emotional portion, and me doing the yoga therapy stuff, the weave in between. And we took a year to put together the manual for the program, which is still the basis for the program. It's evolved and grown, and we have different faculty, lots more faculty. It's become richer, but that was the foundation, which resulted in an 800-page manual. Anyway, this woman who is a doctor, she said, Robin, this is like medical school. She's like, it's medical school light. I mean, there's certainly a lot that isn't, but it's a lot that, you know what? Here's the truth. Computers are pretty sophisticated. You know how sophisticated this is? You know how complex this is? Like, this is what it's easier to be just work with people therapeutically on the structural level, or just on the psychological level, or just be a priest or a rabbi and support people around their spirituality. The ask of a yoga therapist is the whole Panchamaya, all 5 dimensions: physical, energetic, physiologic, right? Psycho-emotional, spiritual, all of it. Have some way of supporting them wherever they are on each of those levels in finding health, well-being, and balance. That's a big ask.
So another quick question. So are you practicing yoga therapy as a yoga therapist?
Me personally?
Yeah.
Oh yeah, I have a full-time practice.
Oh, okay. And from clinical standpoint of view, like in traditional practice, Western medicine, we see patients on routine basis. They come, so and so for their medication, whatever needs to follow through. How does it work in working as a yoga therapist? Because the goal is to minimize their suffering as a yoga therapist, minimize and hoping you don't see them often. That
I mean, eventually, but initially, people come like once a week, and then they have the practice in between, and then they come back and you develop it. And some people stay with once a week for, a month, and some people for 2 months. Some people after a month, they say, let's do every other week or once a month, or I feel like I'm better enough that I can do this on my own, whatever. There's always negotiation around that. But for the first month, the recommendation is to see people every week to at least establish. I always say to my students, like, and my clients, if in a month you don't know if this is effective or not effective, like if you're like, I don't know, I'm not doing my job. In a month, we should have a clear indication of whether this is useful or not useful. And if you're not getting any results, I'm going to refer you out because I'm going to bring the best right up front. I'm not going to hold out and like give it to you later. Let's start with sort of like the medium effective stuff, right? So I'm going to bring my best to you. And if in 4 weeks you're not noticing any change, then I'm going to say, probably this is not the best thing. Like, this is not the thing that's going to help you. But I have ideas then. Since this didn't work, I know enough to know, like, oh, this modality or that modality might be helpful. Go there first and then come back and let's maybe look at yoga as another option later on down the line. So, right. So I hope that addresses your question. That's also individual.
Yeah.
Right. But we try and see people regularly for a month to at least establish some kind of baseline of assessment to, like, accurately be able to know, like, are we on a good track here? Is it making a difference? Is the suffering being reduced? Is the quality of life being enhanced? Not saying in a month, everybody's like magically better. All it takes is a month of yoga therapy. But, what direction is this taking you in? Is it meeting your goals?
I agree. A month, maybe two less anyway. Just, you're coming in with a baggage and then it takes time,
It does, but you also have to understand that people, right now, yoga therapy is not covered by insurance.
Yeah.
So the ask financially and time-wise has to be a nugget that people can handle. So it seems like a 4-week package. That's what we recommend with our students in training, is to invite their clients to sign up for a 4-week, to commit to 4 weeks, and then reassess. And oftentimes they re-up it because they're seeing good results, right?
So this program is both online and on site. You come
Yeah.
and
Yeah. So we have, over the course of the 3.5 years, there are 4 residencies between 5 and 7 days long where we get together, and then the rest of it is online. And that seems to work well. We've done it this way the last 2 iterations. Well, we shifted since COVID. This is the first one we've been able to do to bring in the residencies again. We used to do everything in residency, and it's just been so great. People, I mean, there's a bonding and a sense of connection online, and then when people are in the same room together, it's like, oh my God. Yeah, it's been really fun. Felicia and Donna, would love to hear a little bit from you. And I just want to say a big warm welcome to Mary Scott. I haven't seen you in so long. Awesome to see you. Yes, so Felicia, how are you and where are you with YTT? I know you've been circling me for a long time, girl.
I've been circling you for a long time. I have 2 200-hour trainings that I've done. I did one at Spira when they were still in West Seattle. And then I did a second one with Tracy Weber when she had Whole Life Yoga. And that really got me thinking a lot more about like different ways to use yoga. I'm also a clinical social worker and I have a private practice.
Nice.
And a lot of my clients face, they all have a diagnosis, a mental health diagnosis, but most of them also have a medical issue that coincides, and ways in which I can bring the things together, right? And what I can do for them in those ways. And yoga therapy has always been a thing where I was like, oh, this might be the perfect balance of like, I can work with people in this capacity and then also work with them as a yoga therapist and help them with the physical ailments, the emotional problems, and see if we can actually get some movement and give them something tangible that they can do on their own. So yeah, right now I have a private practice. I've been circling you forever because I also had a baby. He's 5 now, so he's a little more manageable.
Yes.
And I teach too. I teach yoga at the studio in Bonnie Lake where I live. But they actually call me there like the queen of modifications because I'm always running around modifying poses for people and like
Good.
so I'm the class that all the beginner people go to too because they're like, I can't do that crazy thing. And I'm like, you don't need to do that crazy thing. Like there's no actual purpose to that. That's just for fun. So yeah, that's sort of where I'm at. And I always feel better when I'm doing a teacher training, which probably sounds weird, but also not weird. Like it's like forcing you to do your own work to like
Yeah.
have more attention to your own practices, like that accountability that happens. And then also the group part, like some of my closest friends came from my teacher training. So yeah,
Great.
thanks.
All right. Well, I didn't realize that you were so close. I don't know why I didn't register that you were literally circling. Like I live in West Seattle now. So yeah, how about that? Which I love. Awesome. It's awesome out here. Yeah. So, I don't know if you want to stick around for the audit portion. We're going to go into talking about the audit piece, which is more applicable. It's really for people who are already CIAYTs and want to get a little bit more continuing education. But it sounds like you're more at that point where you are interested in like the full-blown program. So please reach out. We can set up a time to just have a sidebar conversation and address your questions and whatnot. Be happy to do that with you. Donna, anything that's arising right now? I see Llewellyn's hand. Okay, Llewellyn's just saying she's got to run. Thank you so much, Llewellyn. Really appreciate your input today.
Yeah, a couple of things cycling. One, I have not been circling you. Literally, probably 2 weeks ago, what was my discovery. And what I feel about that is an amount of excitement. What the fire that is lighting up. Is really kind of interesting to be processing, to be feeling and to be processing. I did not really know much about yoga therapy. Um, and hearing the passion that everybody has, and hearing how it really integrates things. It opens my mind, opens my heart. Um, I have, I'm looking for a second career, as I get to retirement, and I was going more and still will, that will be my first direction is doing teaching that's not for fitness. I'm an athlete. I've been an athlete all of my life. I started yoga was totally for fitness. But as I age and as I age in numbers, as I age in maturity, in all of those physical, mental spheres, I recognize that having yoga, teaching a yoga class that can be therapeutic can be very different from teaching a fitness class.
For sure.
And it's a very needed piece. So my first intention is to gain some further skills. I also have had 200-hour trainings, and I thought I was done and was ready to start being a baby teacher, and then it's like, what is this? So primarily I'm looking at the foundations, and I say that in also realizing I have a PhD in psychology. When I started back to school, I went for my master's, and that was all I was going to do. Until I got into the program, and it was kind of like, oh no, you need to do more. So while I'm here talking about the foundations, I'm very open to that may not be where the journey takes me. I might have more space. So
Great.
my real uh concerns at the moment are coming to end of one career. There's a lot to be done
Yeah.
in that year. um what are some of the logistics?
Yeah, so Donna, just in terms of timing, what I'd like to suggest is that you and I set aside some time to chat about
Let's
this.
do that.
I'd
Okay.
like to address the audit portion for the people who have joined specifically about that piece. And then let those of you who are just who are not certified yoga therapists yet and have queries about that, please just reach out to me. I'm happy to have a phone call or a Zoom meeting with each of you, right? And we can talk about how and what your needs and concerns are. All right.
Yes.
All right. So
Thank you.
so
Thank
just reach
you.
out. Thank you very much,
Thank you.
Sangeeta. I appreciate your presence.